Let's dive into some key MCQs on the complications of chronic suppurative otitis media, CSOM. Question 1. Which of the following is the most common complication of CSOM? A. Meningitis. B. Mastoiditis. C. Facial nerve palsy. D. Brain abscess. The correct answer is B. Mastoiditis. Question 2. Which cranial nerve is most commonly affected in CSOM with complications? A. Trigeminal nerve, CNVB. Facial nerve, CN7. C. Abducens nerve, CN6. D. Glossopharyngeal nerve, CN9. The correct answer is B. Facial nerve, CN7. Question 3. A patient with CSOM presents with vertigo, sensorineural hearing loss, and facial weakness. What complication is most likely? A. Labyrinthitis. B. Petrositis. C. Cholesteatoma. D. Brain abscess. The correct answer is A. Labyrinthitis. Question 4. Which imaging modality is most useful for detecting intracranial complications of CSOM? A. X-ray. B. Ultrasound. C. CT scan. D. MRI. The correct answer is D. MRI. Question 5. The presence of a fistula in the lateral semicircular canal in CSOM is commonly associated with A. Mastoiditis. B. Cholesteatoma. C. Otosclerosis. D. Tympanosclerosis. The correct answer is B. Cholesteatoma. Question 6. Gradenigo syndrome is a rare complication of CSOM that primarily involves which cranial nerves? A. CNV and CN6B, CN7 and CN8C, CN9 and CNXD, CN3 and CN, where the correct answer is A. CNV and CN6. Question 7. Which of the following is a life-threatening complication of untreated CSOM? A. Ear discharge. B. Meningitis. C. Tinnitus. D. Eustachian tube dysfunction. The correct answer is B. Meningitis. Question 8. Which complication of CSOM is characterized by inflammation and infection of the mastoid air cells? A. Otitis externa. B. Mastoiditis. C. Tympanosclerosis. D. Otosclerosis. The correct answer is B. Mastoiditis. Question 9. Brain abscess in CSOM patients most commonly occurs due to spread of infection through A. Blood vessels. B. Eustachian tube. C. Bone erosion. D. Direct contact. The correct answer is C. Bone erosion. Question 10. Which of the following complications of CSOM presents with headache, fever, and altered mental status? A. Mastoiditis. B. Labyrinthitis. C. Brain abscess. D. Cholesteatoma. The correct answer is C. Brain abscess. These questions cover the critical complications associated with CSOM, highlighting the importance of early diagnosis and management. Let's continue exploring more MCQs on the complications of chronic suppurative otitis media, CSOM. Question 11. Which complication of CSOM involves the spread of infection to the dura mater? A. Brain abscess. B. Meningitis. C. Subdural empyema. D. Epidural abscess. The correct answer is D. Epidural abscess. Question 12. Which of the following indicates a poor prognosis in CSOM? A. Mild ear discharge. B. Persistent headache. C. Gradual hearing loss. D. Tinnitus. The correct answer is B. Persistent headache. Question 13. A child with CSOM develops fever, ear pain, and post-auricular swelling. The most likely diagnosis is A. Otitis externa. B. Mastoiditis. C. Petrositis. D. Labyrinthitis. The correct answer is B. Mastoiditis. Question 14. In CSOM, the presence of granulation tissue in the middle ear is most commonly associated with A. Otosclerosis. B. Tympanosclerosis. C. Active infection. D. Cholesteatoma. The correct answer is C. Active infection. Question 15. Which of the following complications is characterized by the erosion of the ossicular chain? A. Tympanosclerosis. B. Cholesteatoma. C. Otitis externa. D. Mastoiditis. The correct answer is B. Cholesteatoma. Question 16. Which is a common cause of facial nerve palsy in CSOM? A. Viral infection. B. Trauma. C. Cholesteatoma. D. Meniere's disease, the correct answer is C. Cholesteatoma. Question 17. CSOM with intracranial extension can lead to which severe condition? A. Cerebellar abscess. B. Sinusitis. C. Pharyngitis. D. Tonsillitis. The correct answer is A. Cerebellar abscess. Question 18. The involvement of the sigmoid sinus in CSOM is referred to as A. Mastoiditis. B. Sinus thrombosis. C. Temporal bone fracture. D. Tympanosclerosis. The correct answer is B. Sinus thrombosis. Question 19. Which diagnostic test is best for detecting early complications of CSOM? A. Pure tone audiometry. B. Tympanometry. C. High-resolution CT scan. D. Otoscopic examination. The correct answer is C. High-resolution CT scan. Question 20. Which of the following symptoms in a CSOM patient indicates a possible complication? A. Mild earache. B. Clear ear, discharge. C. Persistent dizziness. D. Intermittent tinnitus. The correct answer is C. Persistent dizziness. These questions help in understanding the critical complications associated with CSOM, emphasizing the need for timely intervention and management.